Looking after your teeth is vitally important. Children, it's a task that they need to be able to do as much as possible, as independently as possible. And we want to help remove those barriers that are stopping children from being able to do it themselves and teach them those skills to look after the teeth. If they don't look after the teeth, they could end up in lots of pain, they can end up losing the teeth, which impacts on feeding, impacts on general health and well-being. It's vitally important that we teach oral health. The West Silk is a specialist provision in the west of Leeds. SILCs meaning Specialist Inclusive Learning Centre, and the curriculum is geared towards the needs of the children. At the primary partnership that I teach, we've got a range of children from 2 up to 11, and our needs are for severe to moderate learning and communication.
Most of our children are quite complex, but some of the tips I would give probably teachers is just to make it fun. You've got to make it an enjoyable experience for the children. We do songs, and even if that's a different coloured toothbrush or a light up toothbrush. It's important that the toothbrushing is child focused. You've just got to follow the child, and quite a lot of our children have sensory needs, so whether that be like light up toothbrush or like a vibrating toothbrush, so they can have that sensory fix, but also you're getting them to brush their teeth as well.
Some toothbrushing tips we give are videos, songs, so that's encouraging the children to toothbrush and it keeps them occupied. Different brushes, different toothpaste that's not got any flavour to it and it doesn't foam. So for those children with any sensory issues, that would help.
Within our PSHE curriculum, we have personal hygiene. In that, every year I do teeth brushing with our students as a reminder. We use a lot of hands-on interactive tools with them. It's building that relationship with them because it's quite a personal, intimate care. To motivate them, we make it part of their routine, and I think that's the key thing of making it a routine, making them not feel like they've failed in some way because they've got to the age of 16 not being able to brush their teeth correctly. And just having that rapport with them, I think, is the best thing to do, to have motivation for them to carry on and doing that.
So the biggest tips, every child was different and we had to look at the individual needs of the children. We set up visual timetables, we set up symbols use. It became then almost embedded, and having that routine in place, that consistency, and all staff following that, passing that on at home. They've been extended on to going to the dentist. We use things like soft toothbrushes, tasteless toothpaste, making things fun like using songs or videos. We've had children in the past use electric toothbrushes if they've had problems with maybe dyspraxia or a fine and gross motor skill, so it's a lot easier to use electric toothbrush than it is to use a manual. So we adapt to the individual needs of the children.